Jose Marquina, a Central American migrant, has been in South Mexico for 4 months. He arrived just as the COVID-19 pandemic shut down his ability to travel, either north towards the US or back to his home country of El Salvador, which closed its borders. But he may be stuck in the worst possible place, just a few kilometers from the Guatemalan border, a region that now has some of Mexico's highest rates of infection.
Uno quisiera vivir más diferente.
People want a better life, but they don't want to arrive here just to catch the virus and then be sent home to arrive and infect their own families. But when it comes to the virus, those who still want to migrate can do so. It's up to each individual.
At the migrant shelter where he's currently staying, he and his fellow migrants try not to leave. Stepping outside, there's no guarantee they'll be allowed back in. While the COVID-19 pandemic has closed borders throughout Central America, it has by no means put an end to the migration crisis. Gang violence and a lack of economic opportunity still prompt people to flee. And here at Mexico's border with Guatemala, they are finding a country less sympathetic than ever to their plight. Sonia Hernandez is the local mayor and says the migrant issue has made her government's ability to handle the pandemic even more difficult.
Chiapas has the highest rate of COVID-19 cases in all of Mexico, and we are at emergency alert. We don't have any extra municipal budget to be used for migrants. We don't have space in our hospitals, we don't have medicine, and people remain at home trying to recover. That's why we've seen a spike in deaths.
The migrant population in these regions has always been hard to gauge. Their precarious legal status in Mexico compels most to avoid the authorities. And in the middle of a pandemic, society's most marginalized are once again the most impacted.
If it was difficult for a migrant to have access to public health care beforehand, which is a right afforded by Mexico, now it's completely impossible. Right now, they aren't even allowed past the medical institution's front door. Many people are dying, and we don't know about it.
As the migration crisis continues, pandemic or not, the impact of the new normal on the flow of people will be seen for many years to come. Alasdair Baverstock for CGTN at the Mexico-Guatemala border.